Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis S. Scott with What's Happening Birmingham. Today I have the honor and pleasure of having two of my favorite people back on the podcast today. On my left is Gary Burley, my good friend Gary, and on the right is Dr. Williford with Williford Chiropractor and Wellness. Good afternoon, gentlemen.
Good afternoon.
Good afternoon.
Great. The reason why I got these two guys here today, a couple of weeks ago, my friend Gary told me about this great new treatment that Dr. Williford is doing that worked wonders with him. So, Gary, kind of tell us your story.
Well, I got to tell you, man, in 2014, I was diagnosed with cancer. And after going through chemotherapy, I developed neuropathy in my feet. It started out just numb, and then all of a sudden it just built up to just painful treatment. Walking was a problem. And I went through this from 2014 to 2022. So my wife said, why don't you call Dr. Williford? She said, I read on something, online or somewhere, that he had this neuropathy treatment. So I go, well, I've been taking all these medications and this and that, and nothing has worked. So I decided to give him a call. And after meeting Doc and my third treatment, I had more relief than I've ever had since 2014, since this all began. So that's why I'm here today, man. I want everybody that's experiencing neuropathy to consider coming to Doc, because they've got a treatment that works, and here is living proof that it does. Okay,
so doctor, tell us about how did you first come up with this treatment, and then introduced it to Gary.
Well, we've been doing it in our office for quite some time now, and what we've seen is more and more people are suffering from neuropathy. And neuropathy basically is when the body has a stressor and the body's not able to heal itself, and so the nerves start to rot from the inside out. And so what stresses are, usually comes from sugar, diabetes. Okay. And in Gary's case, it came from his chemotherapy that he had. And so the body's inability to heal itself will start the nerves to travel or rot up, and then it will start to tingle, become numb, lose your balance and things of that nature. And so what we've done is devise a program to help people to get rid of this, according to what they're going through.
Okay, so the treatment, how many treatments does it take till you start seeing some results?
Well, every individual is different, and what we usually do at first is we get a history on that person, and then if need be, we do some blood work, maybe some stool, or some type of research on their hormone levels. And then what we do, we cater a plan specifically for that person and what their drivers are, because everybody's drivers are different. Neuropathy can be caused by, as we said, diabetes, type 2 diabetes, chemotherapy. It could be chemical imbalance, or it could be the air that we breathe, but something stressing the body out, and that would start the cascade of events.
So is a lot of this treatment, is it typically hereditary? Or then another question I was going to ask you, does it really go as far as like, how many segment of the population, in your opinion, prior to this treatment, as far as not treatment, what's going on, is undiagnosed?
Well, the majority of what we see here in our office are people with type 2 diabetes.
Okay.
Because diabetes is a big driver of this disease. Because diabetes, as I said earlier, it starts, and the sugar level gets excessively high. It starts the nerves to rot from the inside out, and it sort of damages it. And then what tends to happen, if it goes a prolonged period of time, then you get amputation. Doctors want to cut off certain things. Or they prescribe gabapentin, or they prescribe certain other ailments for you, but it doesn't really cure diabetes or neuropathy. And so what we've done is we change a person's lifestyle. And so once we get the drivers out, the body will actually start to heal itself. And it will overcome all of those other things that has been going on with it. And so, people weren't born with diabetes, they're not born with neuropathy, but however, because of our diet, in most cases, we see that it elevates it with the neuropathy problem.
So Gary, when you first started after going to Dr. Williford, when you started noticing those first kind of instant, man, I feel a little different, a little hop in my step?
Well, I tell you, my wife had a inauguration. She's the president of Miles College. And I went to the inauguration after, I think it was my third or fourth treatment. And I went to the inauguration, and everybody's out on the dance floor. And I said, I'm going to try it, because my feet were feeling better. So I got out the dance floor and I danced. So I said, this stuff really works.
Okay.
Why I've got to continue doing these treatments. And that's where I'm at right now.
So the treatments, are they like, I guess, explain, is it like in the shots, like in the arm, or is it like take a pill? Or?
No, we do no drugs, no surgeries,
okay.
No treatments. Most of our treatments are involved in what they call red light therapy, where we do an infrared light that penetrates beyond the surface level, and it actually stimulates the mitochondria to produce more healthy red blood cells, and that also helps with the neuropathy problem. And we also use a machine called a telemax machine, which actually innervates the nerves and makes them wake up again. And those are 2 treatments that we use here in this office, and they help stimulate and just reverse the disease process.
Can you maybe spill, maybe one myth? Is it typically happen in older men or older people?
Well,
women
right now we're seeing it. We're starting to see it happening in younger and younger people.
Okay.
I mean, I have people as young as 40 to 50 years old. But most of it, we used to see this disease back in older people, older men and more women. And it's like back in the day, when I was coming up as a child, we grew up in a small town. And so when somebody had diabetes back then, they called it the sugar. They said, Mr. Jones got the sugar. Mm-hmm. And everybody knew Mr. Jones had the problem. He might have been losing his eyesight. He might have had an amputation because of diabetes. But now, today, there's over 200,000 Americans with this disease. And since COVID, the numbers have doubled. And there's been more youth, in their 20s, in their 16, that have gotten diabetes because they sat home, they weren't active, and they ate a lot of junk food. And junk food, the body runs on glucose. And so when you eat too much glucose, that glucose flows through the blood and it starts to actually rot the nerves from the inside out.
Some of the things that make me want to just, after this interview, go walk a couple miles, take some stuff. Because I think a lot of people did, say during the pandemic, they was at home, and a lot of people didn't exercise a lot and everything.
Correct. And exercise actually drives the glucose out of the blood system and puts it back in the muscle. And so exercise plays a big part of it. So I ask everybody to at least do 30 minutes a day or an hour 3 times a week, and that helps bring down your sugar levels as well.
Okay, well, let's talk about your practice in general. Because it seems like you're kind of like doing different cutting edge. Because most times people think when they go to the chiropractor, it's like, oh, he's going to hurt me or he's going to stretch me out a little bit. What is your unique approach to doing chiropractic and wellness?
Well, my unique approach is I started out earlier when I had a back injury. And that's what actually got me into chiropractic. I injured my L4, L5 disc. And so I was back in '96. And since then, what's gotten me more into wellness is because as much as I was exercising, as much as I was eating right, I came down with type 2 diabetes.
Oh, wow.
And actually I had, once I found out that I had type 2 diabetes, I started to do some research. And it took me about 6 months to actually get off my metformin. I was taking 1,000 milligrams in the morning and 1,000 in the afternoon. And after I started exercising, started cooking my meals at home and eating healthier, I was able to reverse my diabetes because I didn't want to see those problems coming at me down the road with my eyesight going bad or amputations. I've known people in my family that had to have their toes cut off because of diabetes, because the toes actually rot when the nerve starts to rot, because that circulation's not there. And so that, your kidneys could go bad. You can have heart attacks and strokes from this one disease.
So, that made me think about, recently what happened with Coach Deion Sanders with Jackson State. Had one of his toes cut off or amputated or something. Maybe I have to go back, and if I say something wrong, y'all apologize. We just conversated. But that makes you think, like, a lot of times, a lot of people think because they got diabetes, that usually end up being the end game. Right. Because by that time, it's almost, I wouldn't say too late, but you're so later in the stages. I think one of the great things you did, you was able to kind of stop it or even reverse it.
I reversed it. I haven't taken a pill for diabetes in over 5 years.
Oh, wow.
And that's what we do here at this office right now. So what I found out that more of our people suffer with this disease than other populations. And so what we wanted to go into more of a wellness, because over 50% of the population has suffered from this disease, and this disease causes other things. The quality of life is down. You become tired and you get sick more often. And so when we see people coming in with diabetes, we can actually help them reverse the situation if they want to follow the meal plan, because it's not a diet, but it's a change of your lifestyle.
Oh, okay.
You can't go back to eating fast foods and junk food and things of that nature, as long as you stick to the plan. Most people think that my mom had diabetes, my dad got diabetes, so I'm gonna get diabetes too. But they all eat from the same place.
Yeah.
And that's what causes it.
Yeah, now you think about it. So what do you, like, Gary, back to you.
Okay.
Like, how has it changed, because, like, you've been on my podcast before, and, praise God, you got your, kidney and everything transplant. How has the last couple of years, even dealing with this, changed your whole perspective, your teen health journey? And
Well,
stuff?
being a former athlete, you fight through any situation. And I just took the pain and said, well, there's no cure. Every doctor I talked to said there's no cure, but you can take this, you can take that, take that. So I just dealt with it. But it was like walking on glass. That was the way the pain felt in your feet. And when I got here, like I said, after 4 treatments, the glass kind of got smaller, and then it got smaller. And now I'm just hoping that sooner or later, one day, treatment is going to end and I'm going to be well. But I tell you, anybody that has the neuropathy needs to have at least one check with doc.
Okay.
Just one. Come in here and see what this can do for you.
So where you located, Dr. Williford?
We're located on 201 Beacon Parkway West, Suite 401. We're upstairs, and we're in what they call the Homewood area, but we're actually in Birmingham. That's the line that divides us. But yeah, and our number is 205-909-7373. Come see me. We'll have a special for you. For those who are interested, we have a $49 special. You get your first treatment to see exactly if this can help you or not.
And another thing I want to say too, and I think Gary kind of touched upon that, is, don't be afraid to seek a second opinion. A lot of times, we may have been with our physician for years, and a lot of times physicians might get locked in tunnel vision, how they look at different treatments, that we never look at other alternative methods of, kind of when it comes to approaching these different, diseases and things that's out here.
And most of the people that come to my office are people that have been doing all those other treatments with the medical route. And then they finally find something that, they say, I'm tired of having this pain, so I'm gonna go try something else. And that's where we've been getting a lot of people from, just being tired, or sick and tired of being sick and tired.
Okay, so any final thoughts, Gary or Dr. Williford? Anything you want to say, even African-American men that might be watching this, interview right now?
Well, guys, I got to tell you, if you want a cure, from alleviation from the pain, I'll put it like that, come over here and get the treatment. I'm living proof that it works.
Anything, Doc?
Yes, because it runs predominantly in our society, that I will urge every black person to actually come and seek treatment. If you're suffering from this type of pain and has been going on for years, give us a try. Okay,
well, thank you too for coming on today. Gary, thank you for inviting me, and I always love to bring you on the podcast, but thank you for definitely inviting me to talk about it, because I think this is such a unique treatment. And of course, you've been on, always have you back on again to kind of talk about this. But y'all, please check them out. Please, thank you all for watching this video. Please check out what'shappeningbirmingham.com for more interviews. Don't forget to subscribe to the YouTube channel, and I'm on Apple Podcasts, so check me out. Thank you all again. Have a great day. Bye-bye, and come and get tested.
Come get tested.
Thank you, Doc.
Thank you.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.